over 60, drink this to lower blood sugar fast. If you're over 60 and your glucose is stubborn, there's one simple kitchen drink that can help your body handle sugar better, and you might notice some effects within hours. It's not a magic cure, but it's a focused, evidence-backed tool that targets a root biochemical problem of aging, falling nitric oxide. Stay with me, because I'll walk you through a ranked list of 10 drinks from least useful to most powerful, explain how and why they can help blood sugar control, and give you a clear 30-day protocol you can try safely, plus the precautions you must take first. Here's the quick promise. Restoring nitrate-driven nitric oxide signaling in older adults can improve blood delivery to muscle and skin, and that improved circulation supports insulin delivery and glucose uptake. In plain terms, when blood can reach your muscles more easily, insulin can do its job better, which can translate into lower blood sugar readings for some people, sometimes within hours to days in studies that measure vascular response. I'll be specific about doses and timing, and I'll be clear about limits. No drink cures diabetes or replaces your medicine, but if you want an actionable low-cost step that many older adults can add to their morning routine, you'll want to hear this. If this sounds like you, try the 30-day challenge I describe later, but before you start, pause and record your baseline fasting blood sugar and blood pressure. If you're ready, note those numbers now so you can compare after 3 or 4 weeks. Why this matters. The biology in one paragraph. As we age, the body's ability to make nitric oxide, the gas our blood vessels use to relax and widen, falls sharply. Some research suggests declines on the order of 50 to 70% in older adults compared with younger people. Whether the exact percentage is 50 or 70 depends on the study, but the loss is real. Less nitric oxide means tighter microvessels, reduced blood flow to muscle, and slower delivery of insulin and glucose to tissues that need it. Think of insulin trying to get to muscle as a delivery truck. When the highway is wide and smooth, deliveries happen quickly. When the road is narrowed, packages pile up. Dietary nitrates and related plant compounds can be converted by your body into nitric oxide, opening those small roads and helping insulin and glucose reach their destination more efficiently. That's the mechanism linking these drinks to potential improvements in blood sugar control. May help support improved glucose control, is the cautious phrasing to keep in mind. A quick note on evidence and safety. Clinical research over the last 2 decades has examined dietary nitrates, specific plant polyphenols, and flavonols. Studies in exercise physiology and vascular medicine, including work published in journals such as the Journal of Applied Physiology, show measurable increases in blood flow and endothelial function after nitrate-rich meals or beverages. Some participants in trials and self-experiments report changes in glucose readings within hours. Measurable vascular changes can occur within hours in certain studies. That said, individual responses vary, and exact changes in blood sugar are not guaranteed. Exact nitrate content per serving is indefinito and can vary by variety, soil, and preparation method, so I'll give practical, conservative doses rather than pretend to measure every molecule. Now the ranking. The 10 drinks, from not very useful up to the one I recommend for the 30-day challenge. For each, a short verdict, how it works biochemically related to blood sugar, how to prepare it, what to watch for, and who it's best for. Number 10. Water. 2 out of 10. Verdict. Necessary baseline, but not the solution. How it helps. Drinking water supports circulation and kidney function, and staying hydrated helps your body process glucose more predictably. Dehydration concentrates blood glucose and can make readings worse, so water is foundational. How to use it. Aim for steady hydration across the day, a glass on waking and regular sips, especially before and after meals. Cons and limits. Plain water won't boost nitric oxide or deliver plant nitrates. It won't directly increase insulin sensitivity beyond what hydration offers. Best for everyone, but treat water as the baseline, not the active intervention for quick glucose improvement. Number 9. Green tea. 3 out of 10. Verdict. Small metabolic and endothelial benefits. Mild effect on blood sugar. How it helps. Green tea contains catechins and other compounds that support endothelial function and modestly improve insulin sensitivity over time. The vascular benefits are real, but usually smaller than those from dietary nitrates. How to use it. Brew green tea at about 170 degrees Fahrenheit. That lower temp protects catechins. Steep 2 to 3 minutes for a lighter cup, 3 to 4 for stronger. Drink unsweetened. Cons and limits. If you add sugar, you negate benefits. Caffeine sensitivity can be an issue for some older adults. Effects accumulate over time rather than producing a sharp, immediate drop in glucose. Best for people who want a low-risk cup to include daily, combined with higher nitrate options for fuller effect. Number 8. Tart cherry juice. 4 out of 10. Verdict. Helpful antioxidants, but watch the sugar. How it helps. Anthocyanins in tart cherry can support blood vessel health and reduce inflammation. Lower inflammation helps insulin work better. Some studies show modest improvements in metabolic markers. How to use it. Choose no added sugar tart cherry concentrate diluted to taste, or a small 4 to 6 ounce serving of pure tart cherry juice, ideally not on an empty stomach.
Cons and limits. It can lower blood pressure, so if you're on antihypertensives, consult your provider. Also, some preparations add sugar. Use unsweetened or use non-caloric sweeteners. Best for people who need both vascular and metabolic support and who are not on blood pressure drugs or who have clearance from their clinician. Number 3, celery juice, 7.5 out of 10. Verdict: high in dietary nitrates and practical, with measurable vascular effects reported within hours. How it helps. Celery is rich in nitrates that the body converts to nitrite and nitric oxide, improving microvascular blood flow and supporting insulin-mediated glucose uptake. How to use it. Juice 8 to 12 stalks, about 8 ounces fresh juice, and drink on an empty stomach in the morning for best nitrate conversion. For variety, you can dilute with water. Cons and limits. Taste is vegetal and may not be palatable for everyone. Nitrate content varies by source. Exact nitrate per serving is indefinito. People with low blood pressure or on antihypertensives should consult their clinician. Best for people who can tolerate the taste and want a low-sugar nitrate morning drink. If you're on glucose-lowering meds, monitor readings closely. Number 2, arugula smoothie, 8.5 out of 10. Verdict: one of the highest nitrate leafy options by weight, extremely effective when blended fresh. How it helps. Arugula, rocket, packs high levels of dietary nitrate per leaf mass, higher than many other salad greens, making it a potent nitrate source that supports nitric oxide production and improved blood flow. How to use it. Blend 2 cups of fresh arugula with half a cucumber, a small green apple, optional for flavor, but dilute to limit sugars, a squeeze of lemon, and 6 to 8 ounces water. Drink on an empty stomach for best nitrate conversion. Consume within a few hours of blending. If you store leftovers, note that nitrate can degrade with heat and time, so fresh is best. Cons and limits. Peppery flavor can be strong. The nitrate content varies by harvest and season. Indefinito, exact amount. Some people may get digestive upset with large raw leafy blends. Best for people who want the highest nitrate concentration from a leafy green and who can tolerate green smoothies. Rotate with beetroot on other days for variety. Number 1, beetroot juice, 10 out of 10, my top pick for a 30-day challenge. Verdict: the most practical concentrated nitrate source in drink form, strongest immediate effect on circulation, and the best candidate to support quicker improvements in blood sugar handling for many older adults. How it helps. Beetroot juice is rich in dietary nitrates that convert to nitrite and then nitric oxide via the oral gut pathway. That nitric oxide improves microvascular blood flow and can enhance insulin delivery to muscle tissue, which supports glucose clearance from the bloodstream.
In studies and in many self-monitored cases, measurable vascular responses are seen within hours. Some people report early improvements in glucose readings when beetroot is used consistently. How to use it. Drink 8 ounces, about 1 small glass, of pure beetroot juice in the morning on an empty stomach. Wait about 30 minutes before eating to allow the nitrate-nitrite conversion process to begin and to let nitric oxide signaling ramp up. If pure juice tastes strong, dilute 1 part juice to 1 part water or mix with unsweetened sparkling water. Use no added sugar bottled beet juice or fresh juiced beets, but remember, exact nitrate concentration per batch is indefinito. Cons and limits. Beetroot contains oxalates. People with a history of kidney stones should consult their provider before daily use. It can lower blood pressure, so if you take antihypertensives, get medical clearance. Beetroot can cause pink or red urine and stool, beechuria. It's harmless but surprising. Sugar content is lower than fruit juices, but still present in some blends. Choose unsweetened options. Best for older adults looking for the strongest evidence-backed dietary nitrate boost to support circulation and potentially faster improvements in blood sugar handling. Many hooks and transitions while we move from tasty to powerful. Don't be fooled. Number 10 is necessary, but it's not the fix. We move from pleasant beverages that offer metabolic support to concentrated nitrate sources that actually address the nitric oxide shortage, driving poor circulation and sluggish insulin delivery. That is why beetroot, arugula, and celery occupy the top spots. They supply nitrates or precursors that the body can convert into nitric oxide reliably when prepared and timed correctly. How to implement this safely, a practical protocol you can follow. This is the step-by-step plan I recommend if you want to test these drinks for blood sugar support, with an emphasis on the Beetroot 30-day challenge and a rotation strategy that reduces tolerance and gives you variety. Baseline and monitoring. 1. Record baseline numbers today: fasting blood glucose first thing in the morning, use your glucometer, and sitting blood pressure. If possible, also note an average of a 2-hour postprandial reading after a typical breakfast. 2. Take photos of your urine color if you like, beachuria awareness, and note any symptoms like tingling, warmth returning to feet, or reduced cramping. These are subjective but useful. 3. Continue all medications unless your prescriber tells you otherwise. Do not stop or reduce medication on your own. Daily routine for the 30-day beetroot challenge. Morning, best on an empty stomach. Drink 8 ounces pure beetroot juice, or 6 to 8 ounces fresh pressed juice diluted 1-to-1 with water if the flavor is too strong. Wait 30 minutes before eating to allow nitrate conversion and to let any early vascular benefit begin.
If you use antiseptic mouthwash routinely, avoid it at least for the 30 minutes before and after the beetroot drink if your goal is maximizing nitrate-nitrite conversion by oral bacteria. More on this below. Midday afternoon, optional rotation. 1 cup of hibiscus tea, steep 8 to 10 minutes, unsweetened, or 8-ounce celery juice, if you prefer another nitrate boost, can be taken later in the day to sustain nitric oxide support. 3 to 4 times per week, substitute an arugula smoothie for the beetroot morning or add arugula into lunch salads to maintain high nitrate intake without daily juice. Weekly considerations. Rotate. Don't rely on just one source for months without variation. A practical rotation might be beetroot mornings 5 days a week, arugula smoothies twice a week, celery or watermelon on other days, and hibiscus as an afternoon beverage on alternate days. Test and compare. Check fasting glucose on day 1, day 7, day 14, and day 30. Also check a 2-hour postprandial after a standard meal at the same times. Preparation and shopping tips. Beetroot. Buy 100% beetroot juice with no added sugar, or use whole beets and a juicer. If using whole beets, 1 medium beet or about 8 ounces juice is a good target. Fresh juice will vary in nitrate content, so be conservative initially. Arugula. 2 cups fresh per smoothie. Use a high-power blender to fully break down leaves. Drink fresh within a few hours of blending. Celery. About 8 to 12 stalks juiced yields roughly 8 ounces of juice. Hibiscus. Steep 8 to 10 minutes for full effect. Cool if you prefer iced tea. Green tea. Brew at 17 degrees Fahrenheit so catechins remain active. Do not add sugar. Avoid added sugars in any juice. If you must sweeten, use small amounts of stevia or monk fruit and measure the glucose response. Warnings and safety. Read this carefully. Talk to your doctor before making major diet changes or stopping medications. If you're on blood pressure medication or insulin or sulfonylureas, consult your provider. These drinks can affect blood pressure and glucose. Monitor your blood sugar and blood pressure while trying this. Report any worrying changes to your clinician. Specific risks and when to seek medical advice. Antihypertensives. Beetroot, hibiscus, and other nitrate polyphenol drinks can lower blood pressure. If you already take BP meds, there can be additive effects. Check in with your clinician and consider more frequent BP monitoring in the first week. Hypoglycemia risk. If you're on insulin or sulfonylureas, improved insulin delivery could lower your glucose more than expected. Do not change dosing without a clinician's guidance. If you experience shaking, sweating, confusion, or dizziness, check your glucose immediately and treat per your usual hypoglycemia protocol. Kidney stones. Beetroots contain oxalates. If you have a history of calcium oxalate kidney stones, consult your provider before daily high oxalate intake.
Mouthwash caution. Antiseptic mouthwash can kill the oral bacteria that reduce nitrate to nitrite, and that reduction step is crucial to generating nitric oxide from dietary nitrate. If your goal is to maximize nitrate-driven nitric oxide, avoid antiseptic mouthwash within 30 minutes before and after nitrate-rich drinks. If you have oral health issues, follow your dentist's guidance. Allergies and gut symptoms. Some people experience gas, bloating, or loose stools when introducing large volumes of raw greens or beetroot. Reduce dose and increase gradually. Beachuria. Red or pink urine or stool after beetroot is usually harmless but can be startling. Note it and mention it to your clinician if you have other urinary symptoms. What to expect. Realistic timelines. Immediate. Some people notice warmth, tingling, or slight redness in extremities within hours after a nitrate-rich drink. This reflects increased blood flow. In studies, measurable vascular changes can occur within hours in certain subjects. Days to weeks. Improved insulin sensitivity and lower average glucose readings may appear over days to weeks with consistent use and lifestyle support. Variability. Individual response varies with baseline nitric oxide status, medication use, kidney function, and diet.
Don't expect identical results to someone else. Troubleshooting and optimization. If your glucose drops too low, check your glucometer and contact your clinician. Don't reduce prescription meds on your own. If you feel lightheaded or dizzy, sit and check blood pressure. If symptomatic hypotension occurs, stop the nitrate drink and seek medical advice. If you don't notice any change, try the rotation approach, beetroot plus arugula plus hibiscus, for at least 2 to 3 weeks while maintaining consistent monitoring. Consider working with a dietitian or your clinician to adjust medication safely if glucose improves. Why the mouth bacteria step matters. Short explanation. When you eat nitrate-rich plants, the nitrate itself is relatively inert until oral bacteria reduce it to nitrite, which is then converted to nitric oxide systemically. Strong antiseptic mouthwashes kill these bacteria and can blunt the conversion, reducing the effectiveness of nitrate-rich foods. That's why timing your oral hygiene matters if you're intentionally using dietary nitrates to boost nitric oxide. A sample 7-day starter schedule. Day 1. Baseline fasting glucose and BP. Drink 8 ounces beetroot juice on empty stomach. Record symptoms. Wait 30 minutes before breakfast. Day 2. Beetroot morning, hibiscus afternoon. Record fasting glucose and 2-hour postprandial after a standard breakfast. Day 3. Arugula smoothie morning, 2 cups arugula blend. Instead of beetroot, monitor glucose. Day 4. Beetroot morning, celery juice mid-afternoon. Log BP and glucose. Day 5. Beetroot morning, light resistance exercise. Brisk 10 to 15-minute walk to synergize with improved blood flow.
Day 6. Arugula morning, hibiscus afternoon. Day 7. Beetroot morning. Compare fasting glucose and BP to day 1. Take photos and notes. How to interpret results and next steps. If fasting glucose drops modestly and you feel better, continue and recheck at 14 and 30 days. If you see unexplained low readings, contact your prescriber. Do not change medications on your own. If you have no change, consider consulting a dietitian to review carb intake and timing, or try a slightly higher nitrate rotation for another 2 weeks, always with monitoring. What the medical establishment gets right and what it misses. Doctors routinely advise exercise, weight loss, and medications because those are proven pillars of diabetes management. What many clinicians don't emphasize enough is that microvascular dysfunction and reduced nitric oxide play a mechanistic role in poor insulin delivery, so dietary nitrate is a low-cost, low-risk adjunct to enhance what meds and exercise are already trying to do. That said, it's not a standalone cure. Use it as a tool alongside medical care. Final practical tips. Buy unsweetened products and read labels carefully. Many health juices contain added sugar. Start low if you're sensitive. Try half a dose for the first few days to assess tolerance. Keep a simple log. Date, fasting glucose, BP, drink taken, notes on symptoms. This will be invaluable for you and your clinician. Remember indefinite when someone asks for an exact nitrate number. Variability is real, so track clinical outcomes, your glucose and BP, not hypothetical mg counts. The 30-day challenge, a clear call to action. Here's the simple challenge. For 30 days, drink 8 ounces of pure beetroot juice each morning on an empty stomach. Wait 30 minutes before eating, avoid antiseptic mouthwash around that time, and record fasting glucose and blood pressure at least twice per week. Rotate in arugula smoothies 2 to 3 times per week, and use hibiscus or celery in the afternoon as desired. Continue your medications and consult your clinician before the challenge if you take blood pressure drugs, insulin, or have a history of kidney stones. Talk to your doctor before making major diet changes or stopping medications. If you're on blood pressure medication or insulin or sulfonylureas, consult your provider. These drinks can affect blood pressure and glucose. Monitor your blood sugar and blood pressure while trying this. Report any worrying changes to your clinician. Closing encouragement. You don't have to accept stubborn high glucose as an unchangeable fact of getting older. Small, consistent dietary additions that target nitric oxide production can help your body deliver insulin where it's needed and support lower glucose readings for some people, often within days to weeks if implemented consistently.
Beetroot juice is the most practical, concentrated nitrate source for many older adults, but arugula and celery are powerful allies, and hibiscus, cocoa, and other polyphenol-rich drinks can add beneficial variety. Final CTA. If you're ready, take the 30-day beetroot challenge, track your glucose and blood pressure, and compare your baseline to the end of the month. Subscribe for a downloadable starter protocol with recipes for the beetroot drink, arugula smoothie, and hibiscus brew, and share your results with your clinician before making changes to medications. Small, evidence-backed steps build tangible improvements. With the right habits, you can support better blood sugar control and reclaim confidence in movement and daily life.